Hi, my name is Molly, and I will be doing a neuro assessment on my patient Joe. I will start by looking and seeing that Joe is a 35-year-old male, Caucasian. He came to me at the office today. Looks like he's alert and oriented, dressed appropriately for the weather, pleasant affect. So I will start by introducing myself and say, hi, I'm Molly. I'll be your nurse practitioner today, and I will ask him what brought him in.
Recently been having some headaches.
Some headaches? Okay, when did they start?
A few weeks ago.
A few weeks ago. Okay, how long are they lasting when you get them?
A couple hours on end.
Okay, how frequently are you getting them?
Pretty much every day.
Okay. What would you describe the headaches as?
Just kind of a dull, just achy feeling. Yeah.
Where can you kind of describe to where they are?
Kind of above my eyebrow and then wraps around a little bit to the temple area.
Okay. Does anything make those headaches better?
Yeah, usually some rest at the end of the day, and it kind of goes away if I take it easy for a little bit.
Okay. Does anything make them worse?
Uncomfortable situations at work, like if something goes on and I wasn't thinking of that, and it usually starts a little bit more.
Is there a specific time of day they usually come on?
Yeah, around 10 in the morning, 9 or 10 in the morning.
And then when would you say they subside?
Oh, probably 6-ish at night.
6 at night, and
Yeah.
is that after you've gone home?
Yeah, usually after I've gone home for an hour.
Okay. Okay. Is it radiating at all?
Yeah, I mean, like I said, it kind of radiates around the side of my head and the temple area.
Okay. Is it going down to your neck at all?
No.
Okay. Let's see. Are you having any nausea and vomiting with this?
No.
Are you sensitive to light?
Not really. Sometimes maybe a little bit, but nothing. No, not really.
Okay. Are you sensitive to sound?
No.
Are you lightheaded with this?
No.
Any dizziness?
No dizziness.
Does it get worse when you move around?
No, not worse.
Does it get worse when you cough
No,
or sneeze
no, nothing like that.
or when you lie down?
When I lie down, it helps it a little bit.
Okay. Let's see. Are you taking any medications?
No, nothing.
Nothing, no anticoagulants,
Mm-hmm.
no NSAIDs, anti-inflammatory
No,
medications, any over-the-counter,
nothing over the counter.
any vitamins,
No,
any herbs,
no,
nothing prescribed to you at all?
no. I don't really take anything.
Okay. Have you ever had headaches like this before?
No, not really.
Okay, so this is a new thing?
Yeah, maybe within the last few weeks.
Okay. Has anything changed in the last few weeks?
Yeah, I got promoted about 3 months ago,
Okay.
and that's about the biggest change that's gone on.
Okay, and has the work been getting more difficult? Or?
Yeah, a little bit more intense and a lot going on. I'm trying to learn the new job and all that.
Okay. Have you ever had any sinus problems?
No.
Any tumors, brain tumors? Let's see, any concussions or trauma? Is your neck stiff at all?
No, neck's usually pretty fun.
Okay. No recent injury?
No.
Okay. Let's see. And as far as your other health history, any heart problems?
No.
Any respiratory issues?
Mm-hmm.
Seizures?
No.
Strokes?
No strokes.
And you told me you don't have any neck stiffness. Are you using any illegal drugs?
No.
Do you use caffeine?
Yeah, I mean, I'll have a Coke or something, and that usually kind of helps it a little bit.
Okay. Let's see. Have you gotten any recent immunizations?
No, nothing recent.
Have you gotten the flu shot this year?
No.
Oh, okay. What about surgical history? Have you had any past surgeries?
Wisdom teeth out.
Just wisdom teeth?
Yeah.
No, nothing else?
Nothing else.
Okay. What about your family history? Do you have any significant family history on your mom's side?
No, she's pretty healthy.
Obesity, diabetes, any cancers?
No,
What about your dad's side?
nothing there. Same.
What about, do you have any siblings?
Yeah, one sister.
Anything there?
No, she's pretty healthy.
Okay, so no history. Did they have history of migraines or anything like that?
Mm-mm.
Okay.
Yeah, no one in my family has migraines.
Okay. What about any allergies?
I mean, food allergies, but nothing seasonal.
Do you have any medication allergies?
Not that I'm aware of.
Okay. What about do you smoke?
No.
Use alcohol?
No. Well, I mean, once a month maybe.
Do you exercise?
Yeah, I try to get out and run around whenever I can.
Okay. How often would you say that is?
Once a week, probably.
What about diet?
Generally pretty normal. Eat at home with my family, and then eat
How
at
often
work.
would you say you eat out fast food?
Oh, 3 times a week maybe.
Okay. What about any history of abuse?
No.
Either yourself or to someone else? Okay.
No.
Okay. Well, it looks like the nurse grabbed your vital signs before she came in here. It
Mhm.
looks like your temperature is 98.2, blood pressure is 110/70, pulse is 72, respiratory are 14, and your pulse ox is 99. So
Okay.
all your vital signs look good and stable. I'm going to go ahead and, because you're complaining of headaches, go ahead and do a little neuro assessment on you.
Sure.
Just to kind of make sure we're not missing anything and see what we can find out. As far as differential diagnoses, we are looking at first one as a possible tension headache, the second one as a possible migraine, and the third one as a possible subdural hematoma. So looking at his health history and his assessment, we can rule 2 of those out. So I'll go ahead and get started with his assessment. So first we are going to look at the cranial nerves, and we're going to start with cranial nerve number 1, the smell test for his olfactory nerve. So I'm just going to hold something up here, and if you could plug your nose, and you're going to tell me what it smells like.
It smells like orange.
Okay, very good. And if you could plug the other nose. What does that smell like?
Apple.
Okay, very good. So it looks like his first cranial nerve is intact. Then we're going to go to his optic nerve. We're going to assess visual acuity, look at his visual fields, and assess for perla. Let go. All right, so if you could just cover one eye, and I'm going to test your visual fields here. So
Okay.
just tell me when you see me in the peripheral.
Over here? Or over here?
Yes,
Over here.
yes.
Okay.
Ready?
Yep. There.
Okay, and now do it with the other eye.
There.
Very good. Now with both eyes open, I'm going to come around here so we can sure we can see it. Tell me when you can see me from your peripheral.
Right there.
Okay, now top and bottom here.
Right there.
Okay, very good. And then we're going to use the Snelling chart here. So if you could just read the lowest line.
Local, local.
Okay, very good. It looks like you got 20/20 vision.
There you go.
And we will do perla now. So I'm going to look at, see that your pupils are equal, round, intact, and they react to light and they accommodate. So I'm going to test that light here. Very good. Very good. So it looks like both of his pupils react to light and see accommodation. Very good. Looks like they accommodate, and looks like his pupil size are about 4 millimeters bilaterally. Very good. And then we might also, if we are concerned about it, check his optic disc as well. Next, we're going to look at optic nerves 3, 4, and 6, the ocular motor, the trochlear, and the abducers. I'm going to check his 6 cardinal fields of gaze, and I'm going to be checking for any ptosis or nystagmus. So I'm going to go ahead and start, and I'm going to be doing this very slowly here. So I'm going to go up. Looks like he does have a little bit of nystagmus. Looks like he's got a little nystagmus on both sides there on that middle cardinal field of gaze. Very good. Okay. Very good. Now we're going to look at the number 5, which is we're going to look at his motor, sensory, and corneal reflexes. So the trigeminal. So I'm going to start by palpating both his can you just take your glasses off for a second? Palpating his temples here and his masseter muscles here. Can you go ahead and clench your jaw for me and then open? Very good. It looks like both of those muscles are equal bilateral. Can you move your jaw side to side and kind of jet your jaw out and clench your teeth? Very good. And I'm going to do the sharp dull test check for sensories. So we're going to look in these 3 fields on both sides. So if you could just tell me whether this is sharp or dull.
Dull. Dull. Sharp. 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 Dull. Sharp.
Very good. And then I'll also check his corneal reflex. So I'm going to make sure I get on the sclera, or not on the sclera, but on the cornea here. So I'm going to just barely brush that and look for blinking on both sides. Very good. So his blinking is intact. Bilaterally, I don't see any problems. Everything looks normal there. Next, cranial nerve number 7, we're going to look at his facial. We're going to have you have your cheeks out, raise your eyebrows. Can you smile? Can you frown? Can I see your teeth? Let's see. And close your eyes really tight. I'm going to try it. Looks like you can keep them closed. That's good. So your strength, facial strength looks nice and intact bilaterally. No facial drooping at all noted. Next, we're going to go the acoustic test and the vestibular for cranial nerve number 8. And I'm going to do the whisper test. So if you could just repeat after me, I will say a sentence and just say it out loud.
5, 6, 7, 8.
Okay. On the other side here.
9, 10, 11, 12.
Okay, very good. So it looks like his hearing is intact. And we will go to his glossopharyngeal and his vagus cranial nerves, which was 9 and 10. So first I've been listening to him talk so I can assess that his voice is not hoarse. I can do some tests to see that it's not difficult for him to swallow. Looks like his vagus nerves are intact. I can look here. And I'll check his gag reflex, check his pharynx, and look at his hard and soft palate, and see if his uvula, let's see. All right, can you say ah for me? Very good. So I can see his hard and soft palate in there. Everything is equal bilateral. It looks like his uvula is midline. Let's see what else. Let's see. Your pharynx is midline, and then we'll also check your gag reflex on both sides there. There we go. So just make a gag.
Okay.
There we go. All right, so that is all intact. And then we'll move right along to the 11 spinal accessory cranial nerves. And I'm going to check just kind of by assessing visually, see that his accessory muscles are not showing any sort of atrophy, no drooping. I'm going to test his strength by doing a shoulder shrug here. Very good. And assess your sternocleidomastoid muscles. So turn your face into my hand as hard as you can. There you go. Very good. Good. And then I will also check your hypoglossal cranial nerve, which is number 12. And just by noticing, we've been talking, so I can tell that his articulation of words is intact. Can you just open your mouth for me? And I'm going to observe his tongue at rest is not showing any sort of atrophy. It's symmetrical. And then can you stick it out and move it side to side? Very good. So that is all midline. Looks like there's no deviation at all. So I would say that his cranial nerves 1 through 12 are all intact. Next, we're going to look at his motor system. I'm going to just see by assessing him, looking at his body position, there's no drooping, there's no slumping. I haven't seen any involuntary movements, any tics, any tremors, no fasciculations. I'm going to check his muscle bulk, see that he looks like a healthy young man. He's exercises. I don't see any muscle wasting, no atrophy. Can I see your hands? Notice that his metacarpals, there's no furrowing, and again, there's no atrophy noted, kind of in between his metacarpals there. So now I'm going to check his muscle tone. We're going to do a little bit of a passive stretch, range of motion test. So I'm just going to check your elbows here. Very good. No, there's no major resistance going on. Looks like bilaterally, so that's good. And then I can also check your, if you want to, let's see, I think maybe lying down would be best.
Okay.
We'll do a couple more of these tests here.
Okay. This way?
Yeah, that's great. And then we'll also check your kind of your knee range of motion, no resistance noted. Your ankle, kind of just nice and relaxed there. No resistance there. And then I'm going to check his muscle strength, see if there's any paresis noted. So we're going to start with elbow flexion and extension. So go ahead and push against me. All right, and then push against me. There we go. Again, both sides. So elbow flexion and extension. Very good. And then we are going to do that with his, check your fingers. We're going to finger adduction, so push against there. Very good. And both sides. Good. And then try to put your fingers together, your pinky and your thumb, and then pull away. Good. Both sides. Good. Then we are going to do hip flexion. So I am going to, so go ahead and try to push up against me. Good. Hip flexion and extension. So now push back towards the table. There we go. Good. And now we're going to do hip flexion and extension, hip adduction. So go ahead and push out against the hands and push in. Good. So it looks like he's got good strength, both equal bilaterally, and we will also do knee extensions as well. So go ahead and push against me there. Good. On both sides. Good. Now up. Good. Good, good. So it looks like he's got very good muscle strength, especially being a 35-year-old male. Doesn't look like there's any signs of concern. Next, I'll check his coordination. So you can go ahead and sit on it for me. I'm going to check his rapid alternating movements. And we're going to go as fast as you can. Very good. And then hand to thigh. So as fast as you can, flipping it over on both sides. Very good. So that looks like it's nice, smooth, it's fast, it's rhythmic. Very good. And then we'll also do legs to the balls of your feet. So on both sides there. It looks like you're not overshooting. And kind of do it as fast as you can. He's got good balance. He's not overshooting. He's steady. I don't see any chicks or tremors noted. Then we'll also do the finger to your nose. So I'm going to be moving my hand around, and you're going to be trying to find my finger and in between touch your nose.
Okay.
So if that makes sense. So touch your nose and then touch my finger. Touch your nose, touch my finger. There you go. Good, good. So, and then, very good. So now I'm going to assess his gait. So where are we at on time here? It looks like we're already at 21 minutes. So I'm going to have you just walk back and forth. We're going to do just at first just walk normal. So we're going to assess your gait and like see that your arms are swinging at your sides nice and freely. And then can you walk heel to toe for me? And then actually walk on your toes. And then walk on your heels. And then if you could go and you could hop on one foot for me. You're doing really good. And then do a shallow knee bend for me. So just there. Or just a shallow one's good. So perfect. So nice balance, gait steady, good stance. So we're also going to assess the Romberg test real quick here. So close your eyes and just stand there. We're going to test for 30 to 60 seconds. So if we were to really do this for 30 to 60 seconds, but for time's sake, we're not. But we're just going to look for minimal swaying. I'm actually going to stand right here on a real patient, make sure that there's no, make sure that their fall risk is minimal, so I can make sure that they're not going to fall. We're also going to test his pronator drift. So if you could stand like this for me. Very good. And close your eyes. And we're going to watch and see if his arms fall or if they actually rise. So it looks like he's got a negative pronator drift test as well. So it looks nice and steady. Let's see. We're going to do your sensory test again. Kind of all over your body. We're going to do the sharp and dull. So yeah, if you can go ahead and sit down. So I'm going to do, kind of start on your face here.
Dull, sharp, dull. Sharp.
Very good. And I'm going to use a cotton ball to do the light test. So go ahead and tell me when I'm touching you.
Okay.
And where.
Oh, left arm. Left or right forearm. Left forearm. Right knee. Right
Calf.
calf. That's very good. Left calf. Right knee.
Very good. And then I'm going to check your proprioception here. So tell me, I'm going to manipulate your great toe. Let me know if it's up or down, okay?
Okay. Up. Down. Up.
Very good. And we're to check your stereogenesis here. And if you could just close your eyes. And normally we do this bilaterally, but I'm going to speed this up. Go ahead and close your eyes. Hold out your hand. Tell me what you're holding in your hand.
Pen.
Okay, very good. And then graphesthesia. So normally we do this on both sides too, but tell me what letter I just wrote in your hand.
A.
Very good. And then we're going to do the 2-point test here. So you're going to tell me if I'm poking you with one poke or two, if that makes sense. So
1. 2.
Yep.
2. 1.
Okay, very good. So all that seems to be intact. Next we'll move to his reflexes. We'll do his deep tendon reflexes. And look at we'll do his biceps first. So normally we would do this bilaterally, but we're gonna want super, just nice and relaxed here, okay? right, nice and relaxed there. There we go. So we got a little reaction from his bicep, and we'll do the same thing with his tricep. So nice and relaxed. Need that just to hang for your tricep. There we go. And we'll do his, let's see, oh my gosh, what am I trying to say? Brachioradialis, there we go, that's what I'm trying to say. All right, nice and relaxed. There we go. And we'll do your quads here. So if you could maybe hop on the bench. Let that kind of hang. Hang. There we go. And do your plantar. There you go. So his toes curled in. So that's negative Babinski reflex. And then we'll check for clonus. So there wasn't any pulsating there. So very good. And then we'll also check back here. There we go. Alrighty. His plantar reflex as well. So we did his declinated reflexes. All those seem to be intact, so I don't see any concerns with any of his cranial nerves, any of his sensory, motor components, or his deep tendon reflexes. So I'm going to go ahead and do a quick cardio test on him, as well as listen to his lungs. First gonna just assess on the outside here, see that no lumps, bumps, lesions, any tenderness here. I'm gonna listen to the planes here. Normally I would do this under his shirt. So I'm gonna listen to both the bell and the diaphragm. And I don't hear any bruits, any murmurs. And I will listen for the apical pulse. That's what I was trying to think for 1 minute. Both of the delt and the diaphragm. And then I'll also listen to his anterior thorax. And I'm listening for any diminished breath sounds, any adventitious breath sounds, crackling, wheezing, anything like that. And all of his lung sounds are clear, not diminished at all. And then again with his heart sounds, nice clear S1, S2. It's all audible, no murmurs noted. And I'll go ahead, might as well check his radial pulses bilaterally. See that they're 2+, pulse of about 66. And then we'll check his dorsalis pedis pulses. Again, equal bilaterally, 2+, about 66. So going back to the differential diagnosis, we talked about it being, either 1, a tension headache, 2, a migraine, or 3, subdural hematoma. I think we could rule out the second 2 with the migraine and the subdural hematoma by his social history and assessment and HPI. And we can go ahead and kind of narrow in that it is tension headaches, mostly by his history, seeing that just switched new jobs, stressful. They do get better when he changes activity, goes home and relaxes. Doesn't get worse lying down, doesn't get worse coughing or sneezing. So all those are good things and manageable. So thank you, Joe, for coming in.
Thank you.